Today, we're diving into one of the toughest questions in medicine. A situation where trying to do the right thing, well, it gets complicated. It's like walking an ethical tightrope, and we're going to look at a framework designed to help people do just that without falling. So let's just jump right in with a huge question. At first glance, you'd probably say, of course not. Helping someone in pain is the whole point of medicine, right? But what if the very thing you do to ease that suffering could also potentially shorten their life? This is exactly where good intentions run into really serious consequences, and it's the core of what we're exploring today. And to really get our heads around this, we're not going to stay in the world of theory. Let's look at a real-world case that makes this dilemma painfully clear. We're talking about a patient whose situation forced his doctors to face this exact question head-on.
So here's the situation. We have a 46-year-old man. He's got advanced bone cancer, and he is in an incredible amount of pain, just debilitating. The standard medical play here is to give him strong painkillers, in this case morphine, and to keep increasing the dose to manage that agony. Seems pretty straightforward, doesn't it? Well, it's not quite that simple.
Because this was the exact moment the medical team finds itself at a huge ethical crossroads. The treatment that's supposed to help, the morphine, it also comes with this really significant unavoidable risk. The very thing that offers him comfort could also be the thing that shortens the little time he has left.
And this lays out the bind they're in perfectly. Look, on one side, their goal is so clear: relieve this man's terrible suffering. That's their duty. But on the other side is the risk. They know that high doses of morphine can slow down a person's breathing, and that could potentially speed up a death that's already on its way. They're stuck between the duty to provide comfort and the duty to preserve life.
So how in the world do you make a choice when there's no perfect answer? Well, this is where a really old ethical framework comes into play. It's called the principle of double effect, and it was created for exactly these kinds of morally tangled situations. Okay, so what does that actually mean? Basically, the principle says that an action that has two effects, one good and one bad, can still be morally okay. But, and this is the most important part, the bad outcome has to be an unintended side effect. You might know it could happen, you might even expect it to happen, but you can't want it to happen. Your entire goal has to be aimed at that good outcome. This quote from our source really just nails the whole idea. The big difference here is between what you intend and what you can foresee. In this patient's case, shortening his life would be a foreseen but accidental result of the action. The intended action is just relieving the pain. It's not the goal, it's a tragic potential consequence. Now, this isn't just some fuzzy philosophical idea. The principle of double effect is actually a practical test. For an action to be considered ethical, it has to pass a specific set of 5 conditions. So let's run our patient's case through this test and see what happens. All right, here they are, the 5 conditions. Let's walk through them. 1, the action itself can't be evil. Well, giving painkillers is a normal, compassionate medical treatment, so check. 2, the good effect is what you intend. Here, the goal is clearly to relieve pain, not cause the bad effect. Check. 3, the bad effect isn't the reason for the good effect. Shortening his life doesn't cause the pain relief. They're separate outcomes. Check. 4, there are no other options. For this level of pain, high-dose morphine is often the last and only resort. Check. And finally, 5, the good effect is immediate. And yes, the pain relief starts right away. It passes on all 5 counts. So when you put it all together, the answer becomes pretty clear. The procedure is ethically acceptable. By giving the painkillers with a single, focused intention of easing his suffering, the medical team is on solid ethical ground, even though they know the risk of hastening death. The principle of double effect provides them with that moral clarity. But the story doesn't just stop with a neat philosophical answer. The source material we looked at points to something deeper. It's about something that goes way beyond the right drugs and the right ethical rules. It's about the profoundly human side of care. What's so fascinating here is the reminder that suffering isn't just a physical thing. Research shows that things like loneliness or the deep fear of dying all alone can actually make physical pain feel so much worse. But when those emotional needs are met, when a patient feels genuine human concern and care, their actual perception of pain can go down. And that's the big takeaway. Ethical principles and medical treatments, absolutely vital, but they're only one part of the picture. Things like compassion, just being present with someone, that human connection can be every bit as powerful as any medicine you can prescribe. It's a powerful reminder that healthcare, at its very heart, is human care. And so that leaves us with this big question that kind of hangs in the air. The principle of double effect gives us a map, but out there in the real world of medicine with all its messiness and emotion, where do we actually draw that line between providing care and causing harm? It's a question doctors, ethicists, and families have to grapple with every single day. Thanks for watching.